Hello, and welcome to Sybil Wilkes Live. Yossi Media is proud to present Check-In and Check-Up for Your Health in partnership with the American Heart Association. In tonight's show, we celebrate Father's Day by celebrating the hearts and souls of men who have made a difference in the lives of people whom they love and who love them. They bravely face the challenges of supporting their families and other loved ones while maintaining their own physical and mental health. We'll discuss the barriers to optimal health for Black men, including chronic stress that leads to adverse health outcomes, mental health challenges, structural racism, and equity in healthcare. Tonight's panel includes licensed therapist Dr. Charles Daniels, Dr. Eric Griggs, comedian and radio host D.L. Hughley, and comedian and entrepreneur J. Anthony Brown. And now, here's Sybil.
Thanks, Tony Scott. Hello, everyone, and welcome to Check In and Check Up for Your Health. I am Sybil Wilkes, and happy Men's Health Day. As we mentioned, this is Check In and Check Up for Your Health in partnership with the American Heart Association as we put a spotlight on men's health. Happy Father's Day, J. Anthony Brown. Happy Men's Health Day.
Thank you, Sybil. What's going on?
It's you. We are checking in and checking up for our health and looking at disparities, Jay, when it comes to cardiovascular disease among Black men and the work that is necessary to remove the barriers to healthcare access. So my first guest, as you see, is my friend, and I do say that, my friend, my colleague, J. Anthony Brown. I'm really excited to have you here in this particular episode. It's always great when we can get you to come on with us. J. Anthony Brown, as many of you know, is a comedian. He's also a radio host, a TV actor. He's an artist. Can you see that? Can you see that?
Well, that's my picture. Oh, okay.
Yeah, he's an artist.
Called Hat on the Table.
That's an original title.
Because that's what it is. Hat on the table. So.
That's exactly what it is. And he has had Jay is a businessman, but he's also here with us today as a man who has had his share of health
challenges, right?
Yep.
Health. Isn't it weird? Because back in the day, they just said your ass was sick, but now it's health challenges. So, yeah, I've had several health challenges. Yes.
So, Jay, let me start off by asking you, how are you? And I know
right now I'm fine, Sybil. I'm doing fine. I just got over COVID, and COVID really took me for a loop. You know,
Yeah.
I had the bad COVID. You know,
not
the 1 day COVID and you're back to work. I was down for like a couple of weeks. So but I'm up and running now. But yeah, it was really rough. So thank God I'm here. Yeah.
Absolutely. J. Anthony Brown, from the early days of the Tom Jordan Morning Show, you've been very open and sharing with people your diabetes diagnosis. A few years ago, you successfully fought leukemia and most recently COVID. So what has been the most difficult for you?
I think the COVID I had.
Most recently, really?
Yeah, COVID, because COVID put me in the hospital for like maybe 14 days and I couldn't do anything, I was down.
And I got to tell you, we were scared.
You were scared.
I know, but it was like, I text your daughter, like, how's your daddy today? And she's like,
I just want to go out with a hospital gown on with my ass out. Like, Lord, let me get home and put on some street clothes and then take me to glory.
So COVID was the most challenging, and because you were hospitalized, all the other things that you've had, like when you had leukemia, you went for treatment.
But it was, you sit there for a couple of hours, you get your treatment, and then you're up and you go. So it didn't affect anything in terms of your life. COVID did, voice-wise, weight-wise, depression, eating habits, so COVID across the board for me, not everybody, affected all of those elements. So you're sitting there going, I'm never going to get better, and how I'm going to get out of this. This is, the worst thing that has happened to me. And, trying to keep a positive attitude. And it was rough. It was really rough.
Yeah.
I never thought I was going to die. Even when I had leukemia, I just didn't know how long I was going to be sick. And
Mm-hmm.
that was the frustrating part. How long am I couldn't even walk from here to the door. I
Right.
was so weak. So it's like that was the frustrating part, that I didn't see myself getting better, you know.
Yeah. And Jay, I just from the outside looking in, we were all like, well, can you eat? And you had no energy, you had no appetite. It was, and as you said, this affected your mental
Right.
stability as well. I mean, you're always funny, and you always, leave people
Well,
with a laugh.
I was
But
pretty. There was some funny things that happened in the hospital. They put a depends on you right away. I mean, like Sybil, like they don't they don't waste them, especially if they know your ass is weak. If you weak, you're depended up. You are.
you're dependent up. That's a new
Yeah.
terminology.
If you can't, like, next thing you know, your ass is out. You got to depend on you, and you're eating some really, really soft food. But it's weird because the first couple of days, you're like, this is hospital food. And then by day 3, you're like, well, what time that food tray come through? But I didn't know I had COVID, and I went and I got checked because I had
Because
I
you were
think I
about
had
to
a
start
fever or
work.
something like that,
Hmm.
which is what a lot of men, not just a lot of men, just a lot of people don't do. They go, it's a head cold, it's whatever. They kind of diagnose themselves, and it's so easy. And I'm talking about people who have money will
Hmm.
not go to the doctor. They just will not go. I don't know what it is. It has a lot to do with why we don't live as long as men.
Hmm.
For women, well, the other way is women worry men to death. So that's a whole nother show.
Yeah,
We'll do
it's
that show
another
later.
show. You're
But
right.
men
You're
just
right.
have this, I'm not sick. I can look at my dad. My dad had both of his legs amputated, and it took him so long to go see about his foot, and it was gangrene there. He just
Hmm.
wouldn't go. And it's nothing new. It's a lot of men that take that attitude. Won't go to the dentist, won't get their heart checked, won't get prostate checked out, none won't get their blood, none of it. So
Yeah.
it affects the way, how long we're gonna be here.
Yeah. Diabetes, does that run in your family?
Yes, yes,
And
yes.
so
But
that
here's
was
the
that.
old joke. People with diabetes don't run. That's what I thought.
But the disease does.
But boom.
So, uh, I don't remember when you revealed to us that you had diabetes, but that was, I would say, fairly early on.
Yeah, early on in when we were doing the show. And it's so nothing really kind of knocked me out of the loop. Even COVID. I mean, I'm back. There's some people who COVID and diabetes, and they've lost limbs, they've lost eyesight. A good friend of mine by the name of Michael Golder, he got diabetes and he went blind.
Hmm.
So I'm thankful that I've been I've had this disease for quite some time, and none of those things have happened to me. So, and one of the things for me is this: when I talk about it, for me, it might be somebody who says, you know what, let me go get checked out.
Right.
There's something, a little something, I don't know what it is. Let me go get checked out. So if you help one or two people, then that's part of it for me.
That's right.
Yeah.
Yeah. And you did. It was just interesting. Now that working in partnership with the American Heart Association, and you learn about all of the risk factors as far as cardiovascular disease, but also the relationship between diabetes and
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 heart
and
failure.
heart. Yeah, yeah. And so, were you apprised of that? Did your doctors warn you about that as you were
Well,
going through
what
this?
what they said is the thing about diabetes, it can affect. When I say everything, it can affect everything. It can affect your eyesight. It can affect your teeth, your hearing, your heart, your lungs, your kidneys. So you have to stay on top of it.
Hmm.
There's a little thing that between uh, um, uh, diabetes type 1s and type 2s. It's kind of like a little gang thing we go through. You know.
And which gang do you belong to?
I'm rolling with type 2, Sybil.
Okay. Okay.
Because I'm about it.
Okay.
But, you know, one of the things that type 1s are allowed to do, they're allowed to have a pump on their body. You know,
An
so
insulin pump.
An insulin pump. Type 2s don't get that luxury. So, you know, type 1s, if they want to eat a cake, you know, they can turn it up, turn it down. So, turn it up or turn it down. But as a type 2, you know, the body still makes insulin, just not enough. So that's the difference.
And do you have to take shots?
No, I don't take shots. I take medication. Yeah.
Okay.
I take. Let me just say, I take a lot of pills. If you take all the pills and you shake them all up, you could be in a samba band or whatever. Is that a music samba?
Samba is a type of I guess music or dance. Yeah.
That's what it sounds like. Yeah, it sounds just like that. But there are people who take more than that.
But you have always taken vitamins and supplements, and we were talking about this the other day. That and Jay would bring out this huge like packet of, you know, that plastic container that's usually for the month, and it's like 1, 2, 3, 4, 5, 6, 7, and it would go down. You know, Jay had an ability to take this one particular supplement at about, I want to say, about halfway through the show.
No, I would take it first thing in the morning.
Okay.
Yes, because halfway through the show, I'd get sleepy. It was the energy and you come to find out. I think I was taking melatonin or something.
Well, you thought you were taking something else. You thought you were taking something like with fish oil or something like this, and it ended up being melatonin, which obviously for those of us who have sleeping challenges know that is something to help us go to sleep. And it did. So it worked for Jay.
For 4 hours, 2 hours in, I'm out. I'm completely done. It's just it kicked in and there was nothing I could do about it.
Yeah. But you make once you figured out that you were taking the wrong thing for that hour of the day, you know, we got up to it and things like that. So it all worked out, got up to speed with it.
Yeah, we got up to speed on it. Yeah.
Let me ask you this, because you talked about your dad, you talked about other family members and friends. Has your medical journey made you more proactive when it comes to your health, like from the time that you were diagnosed with diabetes to now after COVID?
Think for me, you know, and this is so important. If you're of age and you can get Medicare and Medicaid and Medicare, do it. Please do it. It is very important once you reach an older age to get your medicine, to get some medical. There's so many people that qualify for it that have not filed for it. It was such a relief to go in the hospital all that time and not have to pay any medical bills. So for me, I know I've been to the hospital more than my dad has ever gone. And I think we were probably just as sick. He just wouldn't go. My mom went all the time, but my dad he just wouldn't go. And so for me to see him go through that, it's like the least little thing. I can go to the doctor and I don't have to pay for medicine or to visit a doctor. Now it is a hassle because some of these doctors are so busy. So to schedule might be 2 or 3 weeks. By that time, that lump is the size of a watermelon.
Okay, that's not good. I'm not a doctor, but I know that can't be a good thing.
Yeah, but I'm just saying, and it's not like where you have you can just walk into your local doctor's office and say, hey, what's up? But yeah, I think my journey in terms of trying to take care of myself is much more. I got to tell you a funny story about my dad. My dad had both legs amputated because of diabetes. And so I go to the hospital to see him, you know, and I'm looking around and look at his drawer and he's got a drawer. When I tell you, it's full of honey buns, full, completely. Not just the regular honey, the white icing honey buns.
Oh, yeah.
Yeah. So you
extra sugar.
Extra sweet. So his logic was, and it made sense. I've already had 2 legs amputated. Why can't I have a honey bun?
Oh.
Like, yeah, you're right. Eat up. Eat up, Pop.
That can't be good, Jay. But you do talk about your medical journey and things like that. But you also, in the process of completing your therapy for leukemia, and you moved from Los Angeles to Atlanta. And so when you had, and so you also, as you were going through the whole COVID thing, you hadn't established a medical doctor, had you?
No, and that was a problem in terms of getting a doctor, because my doctor was for so long in LA, Dr. Camaro. He was my doctor. So to move to to Atlanta, the process of finding a doctor, what they do, especially if you have Medicaid, Medicare, they send you to 2 doctors, and then you choose the one that you kind of get the best vibe with. Okay. So that's the process, and that takes a while. But on the other hand, in terms of seeing specialists, they have no problem having you go see different specialists. I've seen heart specialists, I've seen dentists, I've seen I can't even say endocrinologists. Yes. An endocrinologist. Endocrinologist. Yes. Yeah. So
endo.
It's endo.
Endocrinologist. Yeah.
Endocrinologist. So with that being said, it's easier to see specialists and by living in Atlanta, because there's so many doctors here.
So Jay, we are for people that are just joining us, this is our check-in and check-up special in partnership with the American Heart Association. Jay, we like to call this Take a Loved One to the Doctor 2.0.
Yes.
And so what we learned on the Joyner Show, with all, Tom sending us out and doing all of those specials and everything, this is our opportunity to take it to the next level. And with the American Heart Association, we have had the luxury of meeting and working with some tremendous doctors, and especially African-American doctors in a number of areas. So let us join and ask one of our old friends and someone who has been with us here on Check-In and Check Up for Your Health. That is Dr. Eric Griggs. Dr. Griggs, welcome in.
Thank you.
Hey, Doc, what's up?
Not much, man. Just laughing at you in the money bun.
Well, Doc, we need you to be the voice of reason here in a lot of areas. So just to remind people, Dr. Griggs is the health and wellness Doc Griggs is his persona. Eric Griggs is a New Orleans-based community health and community medicine and health educator, dedicated his professional life to raising health and wellness awareness in communities across the country. Welcome in undergraduate of University of Notre Dame and graduate of Tulane University of Medicine. And Dr. Griggs' mantra, Jay, is get checked, get fit, get moving. And Doc, I just want to
say that again, Sybil. I didn't hear it.
Get checked, get fit, get moving.
I like that.
Dr. Griggs, you've listened to J. Anthony Brown's story. And Jay, if you have any questions for the doc, of course, we want you to participate in the discussion. Let us, before we get involved in the final discussion, let's just reset here, if you will. And for folks that are just joining us, this is Check-In and Check Up for Your Health, and we are looking at disparities when it comes to cardiovascular disease, especially among Black men, and the work that is necessary to remove the barriers to healthcare access. And Dr. Griggs, this is an opportunity for folks like Jay and others to ask you questions about, and for you to give us some sense of direction, because you understand, Dr. Griggs, the connection between physical and mental health, mental wellness. And so can you tell us about the relationship between our mental wellness and our physical health challenges, especially as we are fighting a disease?
Yeah, so thank you for that, and thank you both for having me. The first thing I want to do is define terms. We, particularly in the Black community, there's a stigma with anything that says mental. Mental health, mental illness. It's the same. Just put Unc in the back room and get him his plate and bring him a barbecue plate at the barbecue, and hopefully he'll have a good day. We don't talk about that. There's a difference between mental health and mental illness. Mental health is the same as our physical health. We should do all the things that we can to stay mentally well. What's that mean? It means laughing, spending time with friends, doing things that you enjoy, getting enough sleep, not overworking, eating good foods, and going to the doctor. Mental illness that's actually a pathology. It's just like in the body, you have pathologies. If you become mentally ill, there are resources for you, like therapists and doctors and medications to help you get through, so you can still be mentally well and mentally healthy with a mental illness. If we take the stigma away. The connection between mental health and mental illness it's a direct connection, mind, body, and soul, right? As you become, Jay was talking about COVID, he was talking about diabetes, he was talking about leukemia. These things can make you question your existence in the world, in a world that's already stressful.
Right.
When we get stressed, we have these things called cortisol and epinephrine to raise your blood sugar and your blood pressure, which can make you more depressed, as it causes heart disease and diabetes, and it can turn into a vicious cycle if you don't take a step back and just breathe for a minute and reach out for help.
So, Jay, did you experience this? You talked about depression as you were fighting COVID. Did you have it earlier? Okay,
definitely.
There goes the tech guy.
Definitely, you get depressed because, for me, you're stuck in the hospital. You got doctors coming in and taking blood and nurses and stuff like that, and you don't know how you're going to get out of it. You don't see the end. So it can be very, very depressing. You go, if they were like, well, if your temperature comes down to a certain degrees, we're going to let you go home. Well, each day it keeps going up, so you don't go home. That can be very depressing because you feel like it's not up. You feel like you're better. And when the doctors look at you and see stuff that you don't see, and it all has to do with the fact that you're going to stay longer. Yeah, that can be very depressing. Very, very depressing.
And Dr. Griggs, we talked about access because Jay was talking about the fact that he has Medicare and Medicaid and has access and good things, but a lot of the delays in especially Black men getting treatment or just having a regular relationship with a doctor has to do with access, and there's a lot of discrimination. There are a lot of racial barriers that are there. Can you talk about that?
Yeah, so there is such thing as implicit bias in medicine, and we have a long history of a rocky, if not tragic, relationship with the healthcare system as black folks, as African Americans. And if you couple that, well, let's level set. The average female in America lives to the age of 81. The average male lives to the age of 87. There are no real biological reasons for it, other than maybe a few things, but nothing really major. The big thing is behavior. Men we won't go to the doctor. However, in the midst of all of this, we said mind, body, and soul. You got to put a little grace in there. You got to give people grace, but we got to give ourselves grace. Guys, we're really hard on ourselves. The difference between a man and a woman, male and female, is that when a young lady becomes a woman, she begins what's called an annual visit to her doctor when there's really nothing wrong. There's some procedural things, but nothing wrong. And then it turns into, how's your life? How are your grades? How's your boyfriend? Get rid of him. Girls, get your good grades and do what you're supposed to do.
Right.
Well, and that's myself included. As a little boy, every time you go to the doctor, it's something bad. You either getting a shot, you can't go to school, you got an asthma attack, you try to get a permission slip signed, then you start playing sports. And then when you start to play sports, they start the underwear exam. They take their finger and they tell you to turn your head and cough. And it's uncomfortable. So this keeps going up until the time you're 16, 17. And by the time you get 18 and can make your own decisions, you're like, man, as soon as I get old enough, I ain't never going to the doctor again. Never. So we're 18. We're going through our years of immortality. There's nothing wrong. We can stay up all night. We can party. We can play sports. We can do everything until about the age of 30 when your testosterone levels start to decrease a little bit. Usually takes you about 2 weeks to get in shape. That hangover that would you'd be fine by sundown the next day, last 2 days, and you're wondering what's going on. Well, what happens is your genetics start to kick in too. So finally you get to about 35 and you're like, you know what? Someone pushes you, usually a significant other, pushes you to go to the doctor and get checked out. And then they start, that's when all the pre's start, all the pre's. Pre-diabetic, I'm pre-hypertensive, my cholesterol is pre-this, pre-that. You know what? I was right. I knew I should have never went. That's bad news. Age 40 hits, and then that's exactly what Jay said happens. You go to the doctor and they tell you you're hypertensive. They tell you you might be diabetic, but then they also walk out of the room and start talking, and then they bring the students in to talk to you, and you get then we make the tragic mistake of saying that, listen, we can manage this with lifestyle changes, not knowing what our lifestyle was before. We postpone and postpone until something tragic typically happens. Either there's the heart attack, there's a stroke, there's a diagnosis of diabetes. Then we hit age 50, and then they want to do the underwear exam, the goosing and the goosing, with the finger and the colonoscopy.
Right.
Put these things off because we're afraid of bad news and we don't want to go to it. So it's kind of not our fault, but it is our fault because no one has ever modeled for us the behavior of a positive experience with a doctor. We didn't have things like we're doing today, talking about health with people that we can identify with in a non-threatening manner. Right. So we got to give ourselves a little grace, but we still got to go to the doctor.
So for people who are not like J. Anthony Brown, who, the person that you discuss, once they hit 18, they said, I ain't never going back. What are the first steps you would advise people to do? Because we're number one when it comes to cardiovascular disease. We're number one when it comes to hypertension and things like that. What are those steps and what are the recommendations you would make, perhaps even for a partner to encourage her man to get into a healthier lifestyle?
So the first thing you do is, that's why I say get checked, get fit, get moving, right? Get checked. Climb your family tree. Start asking those questions. Zay was talking about his dad. Dad, how old were you when you first got diagnosed with diabetes? Or when did you lose your first foot? When did you first realize that something might
over a honey bun? Would you have this discussion?
Over a honey bun. But and even prior to that, if you're 18, start going to the doctor with your family members. Start going, because what happens is when you get in the doctor's office and they might say you don't have cancer. You know, all I heard was cancer.
Right.
So you want to be there to be that person to document and document for them. But most importantly, you want to learn the process. You learn by doing. So between 18 and 25, the first thing I do is talk to your parents, talk to your significant others, talk to your older relatives or any of your relatives that might have illness, and find out what's going on. And then go to the doctor yourself, because everything's fine then usually, right? So you can get a baseline. My blood pressure is normally 120 over 81. Doc is up for what happened? Maybe I need to do this. And when you start having the more non-confrontational and non-threatening visits you have, the easier it is to go, and when something's wrong and you hear the whole conversation. He didn't say you don't have cancer. He didn't say it depends, and you think that you're going to put on that diaper he was talking about. Depending on what you might do, you might not have cancer.
Right. I have a question. From watching this show, and then, when I went to the hospital, I would see more and more and more Black doctors. And
especially in Atlanta.
Fox did a show about this. Is there still that stigmatism out there where people are like, well, I'm not going to a Black doctor. I am not going to go to a Black. Have you sensed that or felt that in terms of your practice?
Yeah, so unfortunately, that still exists in our community. A lot of times as Black men, we use it as an excuse not to go. But all of the studies show that outcomes are better when there's someone that you can identify with.
Right.
Now, the unfortunate stat that goes with that, when you talk about Black men, only 2.6% of all doctors in the entire country, 2.6 are African-American males and 4.6 are African-American. And this is the same stat. We're about where we were in 1978. So it's unfortunate, but it's something that we have to get through.
Right.
Yeah.
Right.
And I found a statistic that medical school attendance is up for Black students, for African-American males and females as a result of COVID. which I think
Yes.
is a great thing in terms
Yes.
of getting more of our young people
Well,
into medical school.
maybe you could tell us about the time when you got a patient in the room and then you walk in and they go, where's the doctor? And you're like, asshole, I'm the doctor, okay?
So that
And after you answer this, we're going to also bring in our other doctor, and we'll talk about this as well.
yeah.
So
So unfortunately, that actually happened in med school. I was a second or third year med student. You walk in the room and you're coming to do your thing, and they're like, "Oh no, you missed the spot. The trash can's over there."
Wow.
Yeah.
Wow. That's real.
Happens all the time.
That's real. So, Doc, that's an interesting discussion to have. And so let's welcome in Dr. Charles Daniels with us, Dr. Griggs and J. Anthony Brown. And Dr. Charles Daniels is a therapist and chief executive officer of Fathers Uplift, the nation's first mental health and substance abuse treatment facility for fathers and families, and helping fathers become and remain emotionally stable for their children. I dare say we could have used you a long time ago in J. Anthony Brown's case, Dr. Daniels, but we do welcome you in today, and thank you for joining us. Can you talk about, and Dr. Griggs has already talked about the connection between mental and physical health. Can you give us some more on your opinions and your thoughts as a professional therapist and how those two work together?
Absolutely. And thank you for having me. Glad to be here with you, Sybil, Mr. Brown, and Dr. Griggs. It's a privilege.
I get Sybil. He gets Mr. Brown.
Oh, Mr. Sybil, I'm sorry.
Sybil,
I'm kidding.
Sybil,
I'm
the
kidding.
oldest. Okay?
I'm kidding you, doctor. Go ahead, Dr. Daniels.
Yeah, so I think one harsh reality is that Black men in the U.S. are 4 times more likely to commit suicide. And I think also when you look at other issues like lower access to mental health and substance use treatment service providers, as well as competent mental health providers that reflect our population, that's an issue for many Black men in the United States of America. Specifically in Boston, it's hard to find a therapist that reflects a Black person's likeness. There's a shortage of Black professionals that are present to give therapy in the United States of America. We're talking about 4% of professionals nationwide, mental health professionals nationwide are Black. That's an issue. 4%. So when you look at people with clinics like myself who have a high waiting list for people that want to go to therapy, Black people that want to go to therapy, and Black people that are requesting other Black therapists to see them, it's an issue when we don't have many practitioners that are prepared that look like them to be able to do the work. So we're in the middle of a crisis. You know, there was this whole issue in the past where they said, hey, you know, Black folks don't go to therapy. Well, today Black folks are going to therapy. Now we need providers that can serve them. And that's where we are now. We're in a crisis right now as we speak.
And is there anything we can do to help you through this crisis? I mean, what do we do? Advertise? How do we encourage people? How do we make this more public in terms of getting more people in that area, especially people that look like us?
Absolutely. So when you look at, you know, some of the popular professions in the United States of America, when it comes to being a therapist, such as a clinical social worker or mental health counselor, someone of that nature, that's not a popular profession. Right. First and foremost, it's not high paid. And also, a lot of people are not going towards that field. But now we need to advocate to our politicians in our state that we need more mental health professionals and we need them to be paid more, first and foremost. I think, secondly, we need to do what doctors and lawyers do. They start recruiting for their profession in middle school and elementary school and high school. We need to start going around talking to these kids about the need for mental health practitioners in our community and letting them know how beneficial they can be to their community. So I think first and foremost, we need some type of tour nationwide for us to talk about the importance of therapy, but also for us to groom new therapists that can serve us and be of support to us. So I think that's one thing that we can do. Educate our practitioners, our politicians, and talk about why it's important to our kids so they're going to follow us when we leave.
I hold tight for a second. I just want to remind people that this is Check In and Check Up for Your Health. This is in partnership with the American Heart Association. Today, we're putting a spotlight on men's health and got 3 great guys here talking about it. 2 are professionals. One's a professional pain in the butt. But my guest is in that professional pain in the butt.
Who could that be?
I know, right? But we are talking to Dr. Charles Daniels, a therapist and chief executive officer of Fathers Uplift, and our old friend, Dr. Griggs, Dr. Eric Griggs, a medical doctor and and talking about the connection, not only talking about cardiac health, and I do want both of you all to address this, the connection between cardiac health and mental wellness, because, and we talked about depression and things like that have played a part in this, but this is really important, especially when you talk about men and therapy. I think, Dr. Griggs, you will agree that there is a connection, and it's it's difficult enough to get them into a physical doctor to get those physicals, but also in making that next step to talking to someone as a therapist, right, Dr. Griggs?
Yeah, so the thing is, when you say therapy or therapist, most men don't want any parts of that, because that sounds like someone I don't know that I'm going to tell all my personal business to, and I'm supposed to be vulnerable with. And it's just not going to happen, because we won't. Remember, men don't cry, especially black men don't cry. We will suck it up and kind of power through it. And there it is, exactly. Power all the way till someone's giving us CPR.
Okay. Yeah.
But we need to have more open conversations. What takes place out, inside the office of therapy? Like, what is that? Are you going to be playing with my brain? Are you going to try to make me cry? Just destigmatizing that whole concept. Now, the connection between mental health and cardiac health, believe it or not, it's as simple as breathing. We live in stress soup, right? There are two main hormones that govern your stress response, your fight or flight response. There's cortisol to raise your blood sugar, and there's epinephrine to raise your blood pressure to give you enough energy to release sugar, and your pressure be high enough for you to fight, fly, or hide. When you breathe, when you're scared, the first thing you do is you breathe really, really quickly, right? Which is why I'm not a therapist. One of the things they tell you to do is to slow down. Breathe. Take control of your breathing. As you do this, you stimulate your parasympathetic nervous system, the vagal response, and you slow things down. And you also tell yourself that, look, everything's going to be okay. As you're living in that stress soup, if you don't slow things down, you raise your blood sugar, you raise your blood pressure. It chronically stays high on the pressure side and chronically stays high on the sugar side, and damages all the blood vessels and everything that it touches. Jay was talking about diabetes and, well, COVID as well, touching every organ in your body. As those things are damaged, they have to heal, but blood still needs to get by. If you push on a door, you push the first time, it won't open. Every time you push harder, right? If there's scar tissue or damaged tissue, when there's blood trying to get somewhere, it's going to push even harder. And that's why the pressure goes up, and it just turns into a vicious cycle. So it starts with something as simple as breathing, finding a friend, and talking to someone like Dr. Daniels, like, say, bro, what you going to do to me behind that door if you want to?
and speaking of, go ahead, Jay. No, go ahead.
I think it's not really a problem. It's just that how we're brought up. Women seem to build a bondage in terms of talking to each other about everything and anything. Men, I see guys who will talk for hours about sports, about a movie, but it's kind of hard for a guy to go, I'm hurting inside. It's like it's funny, but it's real, because.
And Dr. Daniels, do you find that
men don't do that, right?
Yeah, absolutely. There's a lot of shame, guilt, and embarrassment. And also, when we look at that stereotype in the United States of America, that not only are men not supposed to cry, but also men are supposed to be everything to everybody before themselves. It is not familiar that we engage in self-care practices. So telling a man that he needs to date himself is unfamiliar. Telling a man that he needs to go to physical so he can live, that he needs to go get a physical and get his thyroid checked, get pre-diabetes screening, right? Make sure that he doesn't have a vitamin D deficiency. That's unfamiliar to many men. A lot of them don't even know how to use a doctor and how to get an appointment scheduled. And if you're in a state like me, Massachusetts, right, we have statewide health insurance. But if you go to a place like the South, it's hard to get health insurance, right? It's extremely difficult to have a quality healthcare provider if you don't have the means and resource to do that. So Obamacare is one thing, right? But we got to also talk about some of the barriers that prevent men from tapping into services like therapy, right? If you're not in the Northeast, it's going to be extremely difficult for you to tap into those resources. But there's definitely a connection.
Are we doing a better job of taking away the stigma attached to therapy?
I think so. There's a lot of initiatives like Taraji P. Henson providing free therapy, right? Connecting people to practitioners to engage in it. And yes, you have that category of men who say, hey, I don't want to go to therapy. Right now, though, we see a new generation of men that are coming up that are embracing therapy. Matter of fact, they want it, right? They want to find practitioners. This is the only thing. They want to find practitioners that look like them. They're not trying to go to a white therapist, right? Now, if you live in a city like me, there's more white therapists than there are black therapists nationwide, right? So they want to connect, but they want to connect with someone that can really reflect their likeness, understand their culture. And that's hard to come across if you're not taught. And when you go to graduate schools of social work, medical schools, psychology schools, there really isn't many curriculums that teach you how to work with a black man, right? Well,
wow.
we put
that could be a 3-year course altogether.
Absolutely. They need to be educated on how to work with us.
Yeah. Jay, have you ever had therapy?
No, but I've been offered to go. Yes, I have. I have had therapy. Yes, I have. Yeah.
Not marital therapy, which is a whole different. Okay. What about what role? Let me ask you this, Dr. Daniels. What role does other outlets have in reducing and improving mental health and in reducing some of the physical restraints on you? Like a hobby, like I was just talking about J. Anthony Brown's painting. This is his work. Do you encourage that?
Absolutely. I definitely encourage other outlets, right? But if you find yourself having 10 glasses of wine a night, there's something else that you need to engage.
That's not the hobby. That's not the hobby, huh? Okay. I might have to take up drawing now.
That's the difference. And you know what, Sybil, this is the issue, is that some people say, you know what, I go to the gym. I don't need therapy, right? But you've experienced a significant amount of trauma in your childhood, and you're slapping on your wife at home, and you tell me you don't need to talk to somebody, right? There's a difference. The gym isn't your therapist.
Right.
So, I mean, there's levels of issues where we have to engage in therapy, and there's levels of issues where people are functioning without it. They can do it once a month, but they engage in other hobbies. But I think we have to have a balance.
I don't know if you're a part of this company, but I've been listening to a lot of talk radio. They have I think it's a therapy service where you can call and you can get a therapist. You don't even have to go to a therapist's office. You can talk to them on the phone, or you can do Zoom, or you can do a personal visit. I can't think of the name of the company, but so they made it a lot easier than going into the office and sitting down and talking to someone. And you can talk to the same person each time. So yes.
Or a difference. Myra J is with us today, and she says, "So, what about sipping and painting as an outlet for some of these other stressors that we have in our life? Can we do both? Can we sip a little wine and paint there, Doc?
Absolutely. You can sip and paint. But you start slapping people. You start lashing out, right?
No, that's not.
What about stripping and painting? I like that.
Strip club is a great outlet.
Of course.
Hey, do what you got to do. But if you need deeper help, get it. And there's people out there that can talk to you, right?
I think the other thing is, as we get older, we tend not to do anything. Or
and kind of isolate.
You kind of get that attitude of, you'll go someplace and a lot of the young people, what are you doing in here? What are you doing singing that song? So you end up staying in the house and not doing anything. And believe me, when you just set, and you don't go anywhere, it does affect your way of life. It really does. It does.
I agree. Gentlemen, we are coming to the close of this. I just have, I do want to ask you our question of the day, but I also, just a closing remark, something you want to leave with the people here today. Dr. Daniels, could you, just as we leave people today?
To the young folks watching, we need more therapists to serve our community. So consider being a therapist. And also to the older adults in the room, there's nothing wrong with getting help. If you need it, get it. We all got here with somebody's help. Thank you for having me.
Amen. Wow, that's great. Dr. Griggs, what about you? What would you like to leave with people today?
I think y'all knew it was coming. Get checked, get moving, get vaccinated, get boosted, get whatever it is that you need to take care of your mental health and your physical health.
There you
Right.
go. Just one fun, quick question we have of the day, and just want to ask you about your favorite TV watching guilty pleasure.
Yeah.
Is it P Valley? Are anybody a Housewives fan? I think I've mentioned P Valley
I'll go
going into
last because I know she's gonna call me names as soon as I say it.
So I'll make it easy. Keep them with the spirit of strip and paint. It's not P-Valley.
You're a P Valley man. Okay. All right. Okay, cool. That's good to hear. And Dr. Daniels?
I'm embarrassed to say this. I'm from Atlanta. I'm a real Housewives of Atlanta ratchet watcher. I am. I'm ratchet, but I watch it.
Nothing wrong with that. We appreciate the admission there, Doc.
They had COVID at the Pank last week. They had COVID at the Pank.
A timely TV show. J. Anthony Brown?
RuPaul drag show. Okay, shut up.
All right. Okay. All right. Thank you so much. We like to close with our daily inspiration, as if that wasn't inspirational enough. Right. Yogi's jewel today is give honor to those who are due. Give honor to those who are due.
Good show.
I honor all of you. Thank you so much for participating. I hope that we can do this again, gentlemen.
Thank you.
Thanks so much, Dr. Griggs. It's great to see you again. Dr. Daniels, I look forward to talking to you again.
Thank you.
And J. Anthony Brown, you just need help all the way around. Yeah. And we're going to pray. All right.